Stages of baldness. Majority of men experience pattern baldness at some point in their lives. However, the problem is most of them don't notice the early signs of baldness. They don't know when their balding has actually begun. By the time they realize that their hair are actually thinning or receding, a lot of damage is already done. And then it feels like it's too late. Hi, I'm Dr. Navnit Haror, Chief Dermatologist and Board Certified Hair Transplant Surgeon at Dr. Haror's Clinics. I am starting a video series where I'll be talking about the different stages of male pattern baldness. This series will be divided into 5 parts, and in each part, I'll guide you step by step through the stages of hair loss. The idea is to help you understand how baldness progresses and, more importantly, what are the best possible solutions at every stage. So if you have wondered which stage of baldness you are in and how to manage it better, this series is just for you. When a man starts experiencing hair loss, it's important to understand how that baldness is likely to progress. To assess this, dermatologists and hair specialists often rely on something called the Norwood-Hamilton scale. The Norwood scale is the most widely accepted classification system for male pattern baldness. It helps us identify the exact stage of hair loss, and based on that, we recommend the most suitable treatment or solution. The scale has 7 distinct stages, each showing a different level of hair recession and thinning. In today's video, I'll cover the early stages of baldness, that is stage 1, 2, stage 3. These are the phases where hair loss usually begins to show, and noticing the signs early can make a big difference in treatment and recovery. You can track your hair loss in a better way and understand what options may work best for you. So let's begin. Stage 1 is considered the initial stage of baldness. At this stage, a person has a head full of hair. There might be very slight hair thinning, but most of the time it goes completely unnoticed or ignored. The hairline looks normal, with little to no visible recession. So there are no major changes to worry about in this stage. Look at the image. You can see that the hairline looks full and intact, with only a very slight thinning around the temples, which is almost unnoticeable. In fact, most men at this stage don't even realize that any change is happening, because the overall hair density appears completely normal. And when it comes to treatment at stage 1, our focus remains on early intervention. The most common treatment options for stage 1 baldness are almost nothing. If it's progressing speedily, then some medications, multivitamins, lotions can be considered, like biotin, finasteride, or maybe minoxidil. But if it's not progressing, then nothing is required. Sometimes when it's progressing very speedily, then some treatments like PRP, GFC, and some other treatments can be given, which can help improve overall hair density and scalp health. So let's move on to second stage. At this stage, the changes are usually subtle. Stage 2 of baldness is marked by the very early signs of baldness, usually along the frontal hairline, especially around the temple areas, also called as temporal curves. As you can see in this image, there is a slight recession of the hairline. This is often referred to as mature or adult hair, and it's actually very common. Most adult men develop a hairline at this level with about 1 to 2 centimeters shift back from the original position. Sometimes you might also notice very slight thinning at the crown or the vertex area of the scalp, but it's generally not very obvious. So stage 2 is more about mild adjustment in the hairline rather than any dramatic hair loss. As a dermatologist and hair transplant surgeon, I often meet patients who come to me with concerns about stage 2 baldness. Based on the extent of their hair loss, I usually don't recommend anything. Sometimes minoxidil, finasteride if they are losing a lot of hair, or maybe some other techniques like PRP, GFC, QR678 or exosomes. In some cases where the hairline has receded a little more than expected, we can also consider a hairline design procedure, which typically involves around 1000 to 1500, maximum 2000 grafts to create a natural and a youthful hairline. But that is a quite subjective decision. So it totally depends on what the patient wants. If they are into a profession that they want their hair back, then only we go for hair transplant. Otherwise, we can avoid it. Now moving on to stage 3. This is the most common type of baldness in men. And at this stage, hair loss becomes even more noticeable. The hairline at the temple starts to recede further and gradually moves backward. Look at this image. If you look at it from the top, the hairline begins to form an M or sometimes a U or V shape. As this stage progresses, the temple areas have very little hair or no hair at all, and at this stage, concealing baldness becomes really difficult. In stage 3A of male pattern baldness, the hairline looks very similar to what we see in stage 2, but the major difference appears on the top of the scalp, the crown or the vertex area. As you can see in the image, there is significant thinning and visible hair loss in the crown area, while the frontal hairline continues to recede slightly. This combination of a receding hairline and a thinning crown makes the balding pattern more noticeable compared to the earlier stages. So stage 3A makes the point where baldness starts to progress from just the front of the hairline to also affecting the top of the scalp. When it comes to stage 3 baldness, I usually recommend my patients going for a hair transplant, either with FUE or advanced FUE or ultra-receptive hair transplant procedure. At this stage, if you are aiming for a good coverage and natural looking high density, you will typically need around 3000 to 3500 hair grafts. So that was all about stage 1, 2 and 3 of male pattern baldness, along with the treatment options available for these and early stages. I hope this helped you get more clarity about how baldness begins and progresses in its initial phases. In the next part of this series, I'll dive into stage 4 of male pattern baldness, where hair loss becomes even more noticeable and requires more advanced solutions. So make sure you don't miss it. Stay tuned and join me in the next video as we continue to uncover the stages of baldness and the best ways to deal with it. See you soon.